My name is Dr. Joseph Murungu. I'm the Deputy Director in the Africa Regional Lead for UCS Self-Health Core. Identifying, engaging stakeholders, and then communicating cascade data with them is critical for policy formulation and improvement. This module is building on the foundation set in module 1.3, which introduces cascade. The cascades describes the different types of cascades, including strengths and limitations of the cascades. We highlight the importance of communicating those cascade data to various stakeholders and follow up on utilization for policy formulation and improvement. The specific objectives of the module focus on guidance in terms of how to translate the cascade findings into policy and the information required for policy formulation. The second specific objectives also looks at identifying stakeholders for the generation, translation, and operationalization of HIV cascades and describing the process of stakeholder engagement. We are also looking at defining the roles and responsibilities of various stakeholders, including the steering committee and the technical working group for the HIV cascade. Once data is available, the next step is to convene the technical working group as the first step, mainly to look at one, the interpretation of the findings, including the quantification of the gaps, but also going through a process of comparing the findings with other data sets. This can then be followed up by the use of the various root cause analysis tools highlighted in the earlier modules to identify the root causes, but also to prioritize the gaps that need to be addressed. The second step involves stakeholder consultations, where the findings and recommendations are presented to the various stakeholders who then validate the findings. But in the process, additional recommendations for actions are then sought. The third step involves the dissemination of the findings and recommendations to various stakeholders, and various channels and platforms can be used for the purposes of disseminating the findings. In this era of the COVID-19 pandemic, virtual platforms have also come into use, including webinars and conference calls. But other traditional platforms can also be used, including focus group discussions, community advisory boards, as well as the use of social media to drive the discussions. The third step, the last step, involves supporting and monitoring implementation of iterative processes towards the desired performance levels. For this to take place, we need to facilitate and provide resources to support implementation. Policy formulation is a continuous process that starts with identifying and prioritizing the problems that need to be tackled first. And this can then be followed up by adopting proposed action processes depending on the different types of policies that need to be formulated. Implementation is then followed up by monitoring and evaluation, and the findings from the evaluation and lessons learned can then be used to inform adjustment, adoption, or modification of the different policies. In the evaluation exercise, will then be able to determine whether the policies were successful, whether they were implemented correctly, and if they resulted in the desired effect. But for this to happen, we need to make sure that we provide the policymakers with simple and clear information, and it has to be provided from different sources. We consider the macro environment. We also consider processes and the content. But as an example, we can also look at the implications of the different policies on the health system, but also focusing on individuals and population health. In terms of the health system, we consider financial and material resource requirements. We also look at issues to do with human resources in terms of the number of healthcare providers required, but also looking at competencies. And then we also look at supply chain requirements. And then as another example, we can also look at strategic information, looking at data system requirements, data quality, and other processes that are required to ensure the generation of quality data to inform the improvement interventions. Implications on the potential beneficiaries and the community in general are also important to look at. Stakeholder engagement should be planned and initiated early and includes identification, profiling, communication, and management of the various types of stakeholders that are involved in the process. It is a fundamental accountability mechanism, and different approaches can then be used to engage the stakeholders. Some examples that we've used include key informant interviews, focus group discussions, but more recently, we have seen an exponential increase in the use of virtual platforms, such as webinars and conference calls. In the field of HIV, we also work closely with advisory groups to HIV planning bodies and networks of people living with HIV. Various stakeholders, the stakeholders engaged are at various levels. We start with the technical working group. We then have at a higher level the steering committee. And then we also include representatives of people living with HIV, the community, researchers, donors, implementing partner, and technical partners. An important stakeholder that we need to consider in this case is also the media, as they play a critical role in the dissemination of findings, policies, and other relevant information. Members of the different stakeholder groups have a significant influence on policy making and planning processes, and should be identified and engaged early in the process of cascade analysis. The different stakeholders should be involved in a number of processes. But to ensure that this works out well, we need to make sure that there's a common understanding of the relevant concepts, methodology, and related indicators and definitions, depending on the local context. And as a team, we need to identify and agree on the different sources of data for each indicator, and also understand client navigation pathways for seeking HIV services, which is very important when it comes to the data collection, but also the interpretation and translation into policy. Ensuring the use of research and evidence in health system management and policy formulation, as well as decision making and improvement, continues to be a challenge. leading to the no-do gap. However, the findings from the cascade analysis should be synthesized, exchanged, and applied by stakeholders as a process of knowledge translation to accelerate innovation and improvement. This requires packaging and presentation in a very clear and simple language for the policy makers to be able to make use of the findings. Finally, to communicate with the stakeholders, we need to make sure that we have communication objectives that are clear, coupled with simple and clear key messages that are channeled through various communication channels. We need to validate the findings. We need to make sure that we review performance after implementation of the improvement intervention, and key messages are centered around the quality of the data and the methods to improve the quality. It is also critical to disaggregate the data to ensure that the vulnerable populations, such as key populations, children, women, as well as men, but also geographic locations that are more vulnerable are identified and prioritized in the interventions. So in conclusion, it is critical to develop data-informed policies that follow the analysis and interpretation of HIV care and treatment cascades. For this to work, we need to make sure that we plan and engage stakeholders early, depending on the local context, and they should be involved in making decisions, prioritizing the interventions to be addressed, but also supporting policy formulation to ensure that the priority problems identified are addressed. The key messages to be communicated with stakeholders should also focus on the findings, the priority groups, but also the implementation progress towards the desired performance. Thank you.